All right, time again for our weekly Q&A with Dr. Levine. Thanks so much for being here today. Hope you had a nice weekend, huh?
I did. Thank you. Appreciate it.
Yeah. From the story we just saw, how do doctors view that side? We saw the Supreme Court making that decision today. How do you all go about making prescriptions for birth control and paying for it and all that?
Well, you know, physicians have a very complex, complicated job, and that's one of the aspects of patient care is writing prescriptions. And, you know, unfortunately, we really don't get into that part of the deal. We basically decide if we want to prescribe a certain medication for the patient. We're more on the medical side. Is it the right medicine? Is it the right dose? Is it the right indication? And we write the prescription, and then it takes off and it goes to la-la land to a certain degree. We really don't have any control over that. Certainly we see and hear the patients complain a lot about the pricing, certain medicines not being available, having to switch, needing a 90-day supply, 30-day supply, this pharmacy, that pharmacy. It gets very complex, to be honest with you, and it's different for every insurance company, different for every patient, different for certain medicines. So it can be frustrating for the physicians as well as the patients, but in this particular case, it's really out of our hands, and it's a very hot political topic. Yep. In terms of the expense of medicine and who pays for it, that's going to continue from here on out. We talked a lot about the fact that people are relying more and more on prescription medications in our society, so this type of deal is never going to go anywhere, and it's just a political issue, and I'm not a politician. So.
Yes, and it's complex, like you said.
It's very complex. We have a hard enough job just trying to make the diagnosis, get them on the right medication, make sure they don't have any drug-drug interactions and not allergic to it, etc. So it's very complex. We're just a part of the system.
Okay, now let's get back to some questions now. Is it normal for someone of the age of 32 to have 75% of kidney function?
Yeah, you know, it's actually not too bad, and certainly kidney function can be different day to day, so not quite sure what was going on in that situation, but with some dehydration or with certain medications, the kidney function can deteriorate for moments. And a lot of times you just have to get more lab and check that, stay hydrated, make sure you're not on any medications that might interfere with kidney function. But 75% is pretty good.
How do you know that? I mean, how does a person know how their kidneys are functioning?
Probably 75% you would have no symptoms. That probably would be picked up on blood test or urine test ordered by the physician. There's a blood test called creatinine, as well as BUN or BUN. And that is a standard test that most patients will get from any physician to go to the office, the emergency department. Normally, as the kidney function goes down, the BUN and creatinine will go up. And so a lot of times you can determine very roughly the percentage of kidney function.
What are some of the effects of chronic insomnia?
We have to sleep. It is part of a healthy lifestyle, and certainly if you do not sleep, your body does not heal, it does not rest, and so lots of things happen. You feel sleepy the next day, you feel fatigued chronically, you can develop a lot of soft tissue pain in your joints and your muscles, you could pass out, you could have cardiovascular problems, high blood pressure, depression, memory issues, so the body needs rest. It's a problem that's very prevalent, so get your sleep.
Yeah, just go to sleep. That sounds like a great idea. Yeah. We'll be back with more of Ask the Docs right after this. We're back with Dr. Levine, and Doctor, about this question. What causes people to get kidney stones?
A lot of times dehydration can cause that, but a lot of times there are metabolic issues that are going on. A lot of times we like to analyze the stone to see exactly what type of metabolic problem is going on, whether it be high calcium or other low levels of important hormones in your urine that predispose to kidney stones. A lot of times the urologist or your primary care physician will do a urine analysis for 24 hours as well as analyze the stone to try and figure out what metabolic abnormality you have and then try and treat that. But the big thing really is hydration is the most important thing, especially during the summer months, and trying to eat a plant-based diet. A lot of times the animal-based diet that we love here in America will increase the chance of having kidney stones. Again, it's all about the chemicals that are in that food that then get digested and processed in the urine. If you dehydrate it, then the risk of kidney stone goes up.
I've also heard sodas cause it too, if you drink too many sodas.
Well, you know, I think sodas can be a problem. Certainly, it is liquid, but it's certainly filled with so many preservatives and sodium and salt and calories and sugar. So it is not the best beverage. I think the best beverage is water. It's never going to change. Coffee, tea are also some things you could also drink.
Okay, now to some of our call-ins today. A 67-year-old woman after the flu for a month, she still has a strong cough.
You know, we see that all the time. We never know who that person's going to be that has that residual problematic cough after an upper respiratory infection. It sometimes may take several weeks. I would normally get back to the treating physician, get an x-ray, do another physical exam, review her labs, make sure it's not medication, but normally they need some cough medicine, Tessalon pearls, inhalers, things of that nature.
A 5-year-old and a 9-year-old like to put salt on apple slices. Is that healthy?
No.
That's not healthy?
Never will be. Just eat the apple.
I've heard of salt on watermelon. Now that's good.
Yeah, I mean, it tastes good, but certainly it's not something we want to do every single day. A lot of the salt actually is in a lot of the fast food and processed food that the kids are already overeating, so not good. Just leave it alone.
Well.
It's ready to go out of the earth, you know.
All right, man says his hands, legs, and feet go numb. What might be the cause?
We talk about neuropathy all the time. Probably with that distribution, I'd be concerned about the neck, a nerve being pinched in the neck from arthritis of the neck, the spine. So probably I would get an MRI of the cervical spine. That's the neck area. I might include a brain scan as well because you're talking about different areas, and so something might be going on with the brain. Could be another systemic illness such as neuropathy being caused from thyroid medications, diabetes, vitamin deficiencies, unknown. Gluten sensitivity is really big, really hot right now. So sometimes I would recommend they try to eat a gluten-free diet for about a month or so, see if it make a change.
Wish we had more time, but we don't. Now, you can always visit our website and see the answer to these and other medical questions posted online. And if you want to have Dr. Levine answer your medical questions, you can always mail us at the address listed on your screen. You can fax us at 892-7305 or email us at laf@kfdm.com.